So this is just a brief presentation to help you with your project planning. So things that your funders will want to know: how long will the project take? Can I do it within 2 years for RFP and the healthcare research grants? How much will it cost? And who will do the work? Now, I will explain the Henry and Flo Friends Forever as we go along, but there's a couple of things that can help you in your project planning. And this is Henry, but it's Henry Gantt, according to Phil, because I took it from his slides. So this is, you will have all probably heard about Gantt Charts, and this is about being able to start to, a really helpful tool to help you start to plan your project. So this is an example of a simple Gantt chart. And as you can see, it maps out the activities, when things begin, how long an activity is going to take, where the activities overlap. And it's a good way of planning your work. So it shows what has to be done and when. And as I've said, it covers start and end dates. It gives you an indication of how long something's going to last. It will show you where there might be crunch points in terms of where there's a lot of activity going on, maybe at recruitment and intervention delivery stage. And it covers the duration of your project. And this is an example of a less simple Gantt, but what's been done here, as you can see that they're basically, it's quite a dynamic grant in that they're allowing for dates and updates. I've personally not used anything as complicated, but it can be quite, some people find that this is a good way of working. And this is my favourite, and it's purely because it's the most familiar to me. And this is an example of a study Gantt chart from the centre. And as you can see, we've broken down activity, management meetings, training people, finalising protocols, and it's in quite, it needs to, your project Gantt needs to be in that amount of detail so you can actually plan and then resource appropriately. So you need to be realistic about what you're doing with your Gantt. I'm conscious that sometimes we see that there's people have allowed 2 weeks or one particular month to maybe do their protocol, get their ethics done and R&D. Some people put 3 months in. You have to be realistic about based on what work has to be done and the processes that you're going to have to go through, your own approval processes based on the design and the population of your study. This may mean that once you've secured a grant, you need to start work before the money starts coming in, so before the actual start date. So you need to make sure that you build in any preparatory work that would need to be done, for example, about maybe preparing the protocol and your ethics applications, etc. at that point. Please include sufficient time for the analysis and the report writing. I'm conscious that some studies can be collecting outcome measures from patients 1 month before the end of the study, which leaves very little time for doing any, analysis and writing up. And then you need to make sure that you've included time to recruit staff and any contracting that may take time depending on which organisation you work with and who your partners are. And make sure that you're realistic about the time it will take for recruiting your participants. So based on the numbers and based on what you're being guided, your team around you should guide you about how quickly they, what the turnover of patients are that they see potentially, which give you an indication of how much time you would need to allow for participant recruitment. So it's a great idea, and this is what I'd be suggesting that we have a look at in the breakout session after the break, is that list all of the activities just to give you in a rough order, to give you an idea of the type of things that you're going to need to include. And remember to include things like, well, if you're going to have project meetings or management group meetings, where are they scheduled and how often do they occur, and make sure you get those covered as well. It's better if you can work in months and not weeks, because a week planner would be, it would be unmanageable to work with. And if it helps you to colour code, stick to 1 or 2 colours to describe different phases of the project, maybe if there's any preliminary work or different phases of work, then that helps to identify as well. Or if if you're working with a number of partners and different partners are taking different responsibilities, then that can sometimes help to colour code that. So the reason that I said that it was Flow Forever Friends is because the flow diagram is also a really good planning tool, but it's also that will come later on, not in the first stage of application, but it will be required later on. And this summarises the study design, but it gives you a picture of how your patients will go through your project. And you'll link it then to, and it's a good way of linking to your timing of key aspects such as consent and randomisation or intervention delivery. So it's almost like a visual timeline of the patient route, patient journey. And it's a good way of checking that your design maps onto the Gantt, that you're actually saying things happen when they need to. So it's also a good way of double checking. So this is a Gantt taken from a CREAM trial, and as you can see, it doesn't have to be complicated. It is just literally telling you how your patient is going through, and when randomisation occurs and where your follow-ups are, and then what happens at the end. And this is more suitable for qualitative study. So you're still saying that we're piloting stuff, and then we're going to be doing interview and analysis, the qualitative component, but you can still track the journey of your patient or your population and your participants through what will happen to them. So from the point of view, approach to the recruitment, to what happens in terms of the qualitative data collection. So it is possible to design a flowchart for any study. And this one is just an example. Looks a little bit more complicated initially, but however, it's just explaining that this is a mixed methods, and this is a good representation actually. So you can see that there's going to be interviews with clinicians, but there's also routine data, and then interviews with patients. And it's about patients as well as the staff and services around it. And then it's a good description of what happens to patients as they go through, what's happening as they go through the process. So all of this is really in preparation for you and starting point for your costings. One of the things you need to do is build that team around you as well. So they need to be leaders in their field. They need to have the specialist knowledge, and this you'll need people who are going to either be your collaborators or co-applicants that provide an advisory role. But then you also need to consider people who are representative of, as we've talked about with PPI, of the group or population that you're aiming to work with, and you will need people with specialist skills. So this is like your task force that you will need when building a team and thinking about that. So thinking about some of the staffing resources, these are the ones that we consider when we're helping to develop studies within the Centre for Trials Research. So who's going to administer all the paperwork? So there's bound to be the production of patient information leaflets, consent forms, the production of case report forms. Who's going to handle that administration? Who will manage the trial? Who will take responsibility for oversight? Who is that person, and how much resourcing do you think they will need? If your study requires, will your study require a data manager? Will you need somebody who handles all the outcome measures that have been taken from patients or your population, who's going to input that data, clean it and prepare it ready for analysis? Will you need a qualitative researcher if you're undertaking obviously a qualitative study, or even if you're doing a study whereby you're doing a trial, but you want to have a better understanding of some of the patient experiences, and you can have a qualitative researcher would be complementary to that team. And similarly, make sure that you've got a quantitative researcher or statistician that's going to be there for your numbers and to help you with your analysis. Consider whether you need to cost in for a health economist. Early feasibility work might be just looking at the feasibility of carrying out some health economic activity, but it's really important to think about in terms of if you're saying that, well, there are savings to be made, or this will be there'll be cost benefits as a result of what it is that you're proposing. Who's going to be doing the recruitment? Who's going to be delivering potentially your intervention or collecting your data? Will you require research nurses, or will you need field workers? And as we've already discussed previously, you need to resource your patient and public involvement. So just a recap of putting the team together. You've got your applicant team, so this is where your experts come in. And as has been mentioned earlier, you need to clarify the difference between co-applicants and collaborators and consultants, because some will cost and some won't. And then think about the required staffing, so that core team that's going to be required to deliver what you've promised. So again, the Gantt and your flow are really useful, particularly the Gantt, because you can look at the workload during the project, and you can check where things are not possible. And as I've mentioned, don't forget things like your admin support if required. Things also to think about when costing the team. So make sure that when a lot of you will go through your research and development offices, I would think. So it needs to be costed at a post that's appointable to. So and you need to think about that. Also talk to people who've maybe already have obtained research grants, and because they may be able to share some of their experience about what they needed, what they lacked. Having those conversations is really helpful. Check that that your costings and your planning covers the peaks and the troughs of the work. So there's going to be more intense activity potentially at some points than others, and you can cost accordingly across those project months. Depending on the type of study, if you are delivering an intervention that's in addition to usual care, you need to think about, for NHS staff in particular, directly allocated and incurred costs, and also treatment costs and excess treatment costs, but your R&D offices will be able to guide. And similarly, those working with academic institutions, just to have an understanding of how those costs work now. So in general principle, everything at this point, when you're costing, put in for absolutely everything that you would dream of. I would like this, I would like this, and just put it all in. Think big first, and then you'll find that you can start to cut down and get to the bare essentials as you move forward, because there's usually challenges with trying to manage, but it's important that you cost appropriately. There's nothing worse than a study that's been funded but it just hasn't got the resource capacity, because it impacts on the delivery, and it can become a bit of a monster to manage. So it's really important that you get the costings right. Think about your non-staff costs as well. As we mentioned, RLA representatives, do you need to include for dissemination? Are there going to be conferences? What about any training of staff that might be included? Equipment and licenses, are you going to need additional equipment? And if there's any fees attached to particular use of validated measures or licenses that are required for software to allow you to do your work. So it's important to think about your non-staff costs as well. Think about exactly, what it was you would need. It's things like, if you're planning to produce a peer-reviewed paper at the end of it, are there going to be any publication fees attached to that? Those need to be incorporated as well. So some additional tips are to allow for wastage. So if there's challenges maybe with recruitment and you need to shift things around, think about how you might be able to move things around as well. Think about the type of site monitoring required, and all of these are part of your non-staff costs. I do apologise, my dog's just come back from doggy daycare and he's just run up, so I apologise if he starts kicking off, I'll get rid of him. Also think about your subcontractors. A lot of researchers now are working in collaborative teams and across different disciplines and areas, so it's important to find out is VAT applied in this instance, and is tendering required to obtain particular to fill particular roles. So the key points in terms of your project planning are: start the planning and resources early, so have a go now. Cost accurately as much as you can, particularly for those large expenditures. It does take time to pull these together, so involve your finance departments and your research and development offices as soon as possible. Make sure that you're double checking the guidelines for the grant that you're applying for, and be clear about what you can and can't ask for, because sometimes there are restrictions. And obviously talk to people who've done it before, because they will probably give you some great insight and stories about what their experiences were. Thank you. That is the end of my presentation, and I'm happy to take any questions.